Hello, I am Dr. Mirela Cerneianu, and I welcome you to the Wellness Optimizing Warrior MD podcast, the WOW MD podcast. I am not your typical wellness coach, and this is not a typical wellness podcast. Here, I'll discuss educational facts about health, hormones, intimacy, anti-aging, and beauty trends, all very hot topics, to empower you to make great choices when it comes to your health and to your body. I want you to go, wow, I did not know that. Or, wow, this is going to make a great difference for me. Our healthcare system is broken and it needs a revolution. You and I can start one today. I am willing to share my knowledge with the world if you're willing to listen. Let's get started. Hello, listener, and welcome back to another episode in this little mini series of a discussion on how to choose the best doctor for you or the best medical practice that will suit your needs. In the last episode, I talked about a couple of valuable qualities you should look for in a provider and in the medical practice, and I stressed the importance of time, the value of time that is spent with you and for you on the side of the doctor and the medical practice. As we all know, time is extremely valuable, precious, very, very precious. As a matter of fact, it's an extremely valuable commodity. And the amount of time both the doctor and the medical staff will spend with you, getting to know you, addressing your concerns, answering your questions, scheduling your appointment, exchanging information back and forth, is likely one of the most valuable and important characteristics you should look for when you choose a doctor or a practice. We live in a century of speed, and we're overwhelmed by information. And deciding to come to a medical practice where an actual person spends time with you, educating you, answering your questions, it's extremely precious. And then we talked about how the second most important characteristic, it's likely to be the knowledge and the versatility of treatment options that a doctor will be able to offer you and the medical practice has. Then I talked a little bit in the last episode about choosing a doctor. It matters in what type of doctor you choose, whether your purpose for the visit is disease-focused or a wellness-focused consultation. And in this episode, I would like to spend more on this little topic, wellness or focused on disease. It is important, if you have a focused, specific health concern, that you should see a specialist that can address that medical concern. Well, let me give you a few examples. For example, if you're a woman and you experience abnormal vaginal bleeding, you would likely want to see a gynecologist right away. There is minimal value other than likely delaying getting to the right person and getting the right care if you instead make an appointment with a general practitioner. It is unfortunate if you have an HMO because you will have to make an appointment with a general practitioner and get a referral to see a specialist, which will delay your care. But that's the type of plan that you chose for yourself, and there are some downsides that come with that. Another example is if you have, for example, an abnormal colored mole or a lesion on your skin, and you're not sure whether it's suspicious or not. Do you need to address it? Do you need to remove it? Definitely make an appointment with the dermatologist as soon as possible. Now, seeing a general practitioner for this could possibly, again, delay your diagnosis and treatment and possibly send you down the wrong path if somehow the general practitioner is not familiar, thinks it's a regular normal mole. But then the dermatologist could have a different opinion because they're seeing way more stuff on a daily basis and have much more experience. So they're much more sensitized to abnormal areas. The problem comes when there are a lot of subtle symptoms that are not always clear to you, the patient, as to what is causing them. For example, you have fatigue and stiffness and foggy brain, and you don't really know irregular periods. You don't know what's happening. You have weight gain, weight loss, maybe some nausea, vomiting. So it's all over the place. There's all kinds of organs that seem to be affected. In that case, you likely want to see your first line of care provider. that hopefully you have an established relationship with. For example, a family practice doctor, an internist, or your OBGYN doctor if you are a woman. Yes, OBGYN doctors are primary care providers, and we are trained to provide lots of care as far as diabetes management, high blood pressure management, anxiety, mood disorders. We can start patients on antidepressant medication, monitor their antidepressant medication, change them. We can treat thyroid disease. We can treat abnormal periods and gynecological problems. And if you have additional training in hormone therapy, obviously you can provide hormone replacement therapy as well. So a disease-focused consultation should be very, very clear in its purpose and its scope. You have a specific problem. You're looking for a provider that could solve that problem by identifying clearly why you have the problem to start with. And hopefully the doctor that you seek will have a solution and will help you solve the medical problem you're experiencing. Now, many times it's not very easily apparent to you, the patient, who would be the best person that could be able to provide you with the best care or a solution for your problem. So it's not unusual in these circumstances when you actually end up seeing multiple physicians and get sent different wrong pathways and have all kinds of tests that everybody tells you it's all normal, and then you're confused and upset and feel frustrated because nobody's getting to the bottom of this issue. And this is especially when we talk about hormonal imbalances, whether there is a hormone deficiency or a hormone excess. Usually the signs and symptoms are very broad. They're not very clearly indicative of the cause. And it's easy to get lost on this road of finding the right person to treat you for the problem. Another issue, and this is personally, I think it's a huge issue and a problem, is the fact that there is no longer a clear-cut expert that has a label or a certification that you, the patient, could run to when it comes to hormone management. So let me take a little detour and let's talk about this situation for a few minutes. So the question is, where do you go and who do you seek help from in case you have a hormonal problem? Well, you suspect, I know I have hormones and I know I'm a woman in my 40s or 30s and I'm suspecting perimenopause. Where do I go? Who do I talk to? Or you're a man, regardless of age, younger or older, and you suspect you do have a hormonal problem. You suspect thyroid, you suspect testosterone. So this is a very, very important question. And let me try and see if I can answer it for you. Now, this question is very important, especially when you go through menopause as a woman, or you are a man and you suffer from low testosterone and you need testosterone replacement therapy, or you suffer from a sex hormone imbalance during perimenopause. So who should you see? Should you go to an OBGYN? Should you make an appointment with an endocrinologist? Should you make an appointment with a naturopath? Maybe a nurse practitioner. How about a doctor who specializes in pellet therapy? Maybe a BioT doctor or a Sotopellet doctor or a Body Logic doctor. There are so many options out there. It's absolutely no wonder that you, the patient, are very confused who you should go to. What is more confusing is that the practice of sex hormone medicine, also known as hormone replacement therapy, has become extremely controversial in the past 20 years after the release of the Women's Health Initiative study, which labeled all sex hormones, specifically estrogen, as being high risk and causing cancer. Now, these two myths, estrogen causing problems and being high risk and increasing your risk of cancer, are blatant misinformation. And we know that now, 20 years later, but the damage has already been done. Many, many women are absolutely paranoid when it comes to estrogen replacement. They are literally afraid that estrogen will give them cancer or will make them gain weight. So they shy away from it. They avoid discussing it, or if they do discuss it, their belief is so deeply entrenched and their fear is so strong that they make the choice and they prefer to live a life in which they feel fatigued, foggy, achy, irritable, depressed, gain weight, stop having sex with their husbands or partners, etc. I do not want to dwell on why this is wrong and why it shouldn't happen. There's no need to live a life where you're miserable like that. I'm not going to dwell on why estrogen is actually safe and does not increase risk of cancer. I have discussed this subject a few times in my previous podcast episode, and I do plan to have an episode where I will address this specific topic, which is a very, very interesting topic about the beliefs around hormones and the choices men and women make on what to do as far as hormone replacement when they are confronted with a hormone deficiency. And I will dig a little deeper into why the sex hormones, especially estrogen, progesterone, testosterone, are not harmful at all. On the contrary, they are our God-given hormones and our saviors. But more on that topic in the future, so please stay tuned. So let's come back to our question. Who do you see if you realize you have hormonal imbalance or a deficiency and you wish to seek hormone replacement or hormone balancing treatments? Well, the answer is pretty simple. First, you need to know and find out pretty quickly if the doctor or the provider that you are going to consult has additional knowledge on top of what conventional medicine trained him or her. Because this is the terrible, disappointing truth. Conventional medicine not only does not prepare and has not prepared the majority of doctors that are involved in the study and the practice of hormones to appropriately treat and address sex hormone deficiency, adrenal hormone deficiencies, thyroid imbalance, insulin resistance, etc. It also has extremely poorly prepared the doctors to look at the big picture and not just address sex hormone replacement. Hey, here's a prescription for patch and a little progesterone for you. Come see me in a year. It has poorly prepared to take all the hormones into consideration when a plan of care is formulated and developed for a patient. So what I mean by that is you can't just look at the sex hormones like you look and have a monocular vision. You're not going to see the big picture. You're not going to help the patient. A sex hormone deficiency, like I mentioned earlier in my podcast, will create a state of stress, which will unfortunately raise your cortisol. The elevation in your cortisol level will probably throw off your balance on your thyroid, who might have to work a little bit in overdrive. And then it's like a snowball effect. Then you have all kinds of problems, and it starts with one simple thing. So all hormones need to be looked at and addressed. And it's not like, well, we started with low estrogen, let's just fix the estrogen, everything else will come back to normal, because it's not that simple. And you need a doctor who understands that, knows that, will look at all the problems possibly involved in your situation and take action on all of them. So there are multiple avenues where a doctor can get additional training in the matter of hormones. So this is what you want to ask. And the staff who answers your call, and it's your first line of contact with the practice, would be able to provide the answer to that question. What type of training did the provider receive that will empower him or her or make him an expert to deal with your situation? Sometimes you get that information from the practice's website. But again, the question is, what type of training does the provider have that will give him or her the knowledge and the expertise and the experience to deal with your situation? I remember clearly, literally like yesterday, because it's one of those moments when your life changes. I remember the day when one of my patients entered my exam room at my community clinic and asked me if I have experience with bioidentical hormone replacement. It was almost 20 years ago, and yes, I had not been trained in bioidentical hormone replacement at that time. So I admitted I didn't know what bioidentical hormone therapy was. But then I went home that day and went online. I was curious enough to start searching online and understand, what is this meaning? What is the term bioidentical? And how was that different than the hormone therapy I was already administering to my patients using my conventional medicine training? What I found was extremely interesting, and it led me to signing up for a bioidentical symposium. It was a 3-day symposium, and I remember it was exhausting. 8 a.m. to 6 p.m. every day for 3 days, jam-packed with so much information that was lovely presented, absolutely logical, made complete sense. And I had the deja vu feeling that I was going back to school so many times throughout the symposium. I felt enlivened. I felt excited to learn so many new things that tied up all the loose ends of the older things that I had learned in medical school and in residency and throughout my practice, that I remember leaving the symposium excited, ready to put into practice what I learned, but a little bit confused as to why I haven't found out or learned about this bioidentical therapy before. So then I went online and searched what is the best place that I could learn more from. And that introduced me to the American Academy of Anti-Aging, A4M. And it literally opened my thirst for knowledge and wanting to know more. I signed up for the board certification. I got a manual. I read the book. I took the test, became board certified in anti-aging medicine. That was not enough. I signed up for the fellowship. It took me about 1.5 years, maybe 2 years, to complete the modules for the fellowship. But I remember it took me a few months to complete the first 2 modules dedicated to hormones. Not just sex hormones, but all the hormones. So it felt like I went back to school and I learned a lot. And I had to do that on my own free time after I spent many hours working in the clinic and delivering patients at the hospital. But all the information I learned was the information that I needed to put in practice. And I needed to know how to apply that information and the knowledge that I learned to patient care. And that's not always easy or simple because humans are complicated. And the processing and elimination of hormones introduced into the body is very different for each individual. And their reaction and response to hormones is very different for each individual. So hormone replacement therapy has to be highly personalized. So the more you practice it, the more you learn. And the more open-minded as a provider you become because you realize not everybody's the same. So to kind of end this little side note, as soon as I came home from the symposium, I was still working for the community health clinic. I called a few local compounding pharmacists, developed a relationship with them, all of them in Ventura County, and I started practicing bioidentical hormone replacement therapy. A few years later, I decided I'm going to start my private practice. This is what I want to do. And then in 2014, I also trained in pellet hormone therapy because I realized I was missing a key piece of how to replace hormones that was very, very important. Now, what I'd like for you to understand is that there is a problem, and most doctors are extremely, let's call it close-minded. And I don't understand why they refuse to consider going to a training where their minds will be opened and their horizons will be broadened, where their knowledge will be vastly expanded and their patients' results will likely be outstanding. So I am not sure why a lot of physicians have a lot of resistance to wanting to know more or learn more about hormones, and instead, they tell patients hormones are bad for you. I'm pretty sure 20 years from now, we will look back and realize hormone management medicine is the type of medicine we should have practiced all along. And I, again, have no idea why most OBGYNs are so resistant to learning about bioidentical hormone replacement therapy and integrate it into their practices. The truth is, and that's very disappointing for me, an OBGYN physician, that many women consider going to a nurse practitioner or a naturopathic provider before seeking care or consulting an OBGYN in matters of sex hormone replacement therapy. They would consider consulting and going to an endocrinologist before going to an OBGYN because they think, well, they know more about hormones than an OBGYN. So the truth is that hormones are complicated, and especially sex hormones. And there are significant consequences to using sex hormones. So if you're a provider, like a naturopath, a nurse practitioner, a different specialty physician, an endocrinologist, once you administer sex hormones, you definitely want to have an OBGYN on your healthcare team because there will be all kinds of consequences from breast tenderness to vaginal bleeding to changes in vaginal discharge to a worsening of symptoms if women have pre-existing fibroids or polyps. And we are the specialists of women healthcare issues and pelvic floor problems. So hormones are intimately connected to our pelvic floor, pelvic organs. So there are so many consequences to our intimacy and our health as women when we start using hormones that we need to have an OBGYN that's not only friendly and trained in hormones, but has an open mind that, okay, yes, you're using hormones and I'm not providing the hormone therapy for you, but here's how I can help you, instead of undermining the other physician who's actually given the hormones. Maybe you as a physician would want to know more about hormones and learn more about it. And again, this comes back full circle as to why OBGYNs are so close-minded against hormones, which is a very interesting question that I don't know that I have the answer to. So to summarize it a little bit, I wish I had a clear answer to the question, where do you go? And what type of doctor or provider should you choose if you suffer from a hormonal deficiency or an imbalance when it comes to sex hormones specifically? So maybe start with a local search for a bioidentical hormone replacement provider in your area. Now, that wouldn't always reveal the best people. And not because I am one of the best, but just as an example, we recently changed our website from herahealthcare.com to herabeautyandwellness.com. So we have to rebuild our SEO rankings about hormone replacement therapy. So we're not ranking as high when people search for us right now. But regardless of whatever provider you choose and wherever you decide to go to address the hormonal imbalance, please remember you will need a good OBGYN on your team, on your healthcare team, that's going to handle the consequences of estrogen replacement or progesterone replacement. Because when the side effect of vaginal bleeding happens, and that is reasonably common, the appropriate workup has to be conducted and at the right time without delays. So I want to close this little detour I took into what is the best provider for sex hormone replacement therapy and come back to choosing a doctor that focuses on wellness versus disease. As I mentioned before, there's a significant value for you, the patient, in seeking care from a doctor that is knowledgeable in how to promote and maintain optimal wellness. Remember these two words, optimal wellness, because I want to come back to these two words. But let's talk wellness and focused wellness based on some specific important parts of our bodies. And let me use some examples. Let's talk heart wellness for a second. You will likely never know that there's anything wrong with your heart until you actually have a heart attack. And this is especially true if you are a woman. Not so much if you're a man. Men usually start with some chest pain, chest discomfort, so they get diagnosed with angina. Sometimes erectile dysfunction, it's a first sign of cardiovascular plaque and blood flow problems. But what you should know as a patient is that the lipid panel or your cholesterol value literally says nothing about your heart. It tells you nothing, or your provider, it tells them nothing about your blood vessel state of health or disease. Please be aware that a telling test, which is very useful, but for some reason not very often used or recommended by your primary care doctor, is a calcium score. That's an imaging test to quantify the amount of plaque in your heart. Maybe a simple ultrasound of your carotid artery to look for plaque. These are valuable tests that can be ordered And I find myself in a position where I do a wellness check for a woman or a man, and I discuss the symptoms, their state of health. I look at previous labs, and I ask, have you had a carotid Doppler ultrasound to look at plaque? No. Have you had a calcium score? No. What is that? Well, most of the times the patients come back with, well, I have an EKG. And please be aware that the electrocardiogram, it's a very quick snapshot of the electrical activity of your heart. It's not necessarily as representative as it used to be maybe 50 years ago before we had all this modern technology available that can give us a much better evaluation of your heart and your blood vessel state of health. Unfortunately, many physicians and cardiologists put a lot of energy and focus in treating cholesterol only and ignore the actual state of health of the blood vessels, ignoring your ability to make nitric oxide. That is the most potent vasodilator in your body that relaxes and opens your blood vessels for blood flow. They persistently ignore and are likely not very knowledgeable about the glycocalyx, the matrix that supports the lining of your blood vessels. So a lot of the times the blood vessel wall integrity, which actually determines whether you get plaque or not cholesterol, okay? So that gets ignored a lot by many physicians and by many cardiologists. And a lot of the times these specialists, your cardiologist, your cardiovascular surgeon, literally mention in passing, but they most of the time ignore your diet or your intake of foods, ignore your lifestyle, your type of exercise. They ignore your exposure to toxins. They could seriously create inflammation and damage your blood vessel wall, contributing to oxidized and bad cholesterol, which is why you get plaque, not because you have high cholesterol. So heart wellness and looking at cardiovascular wellness is totally different than a disease-focused approach where you actually have a symptom, have a heart attack, and now you're seeing a cardiologist to prevent you from getting another heart attack. It's looking ahead. And if you had an abnormal calcium score, and then you go see a physician like me who's focused on wellness and has your best interest at heart, and you're asked about your calcium score, and you're not sure about your number, but you know that you had a calcium score where the number was more than 0, and it was 3 or 4 years ago, then why has your doctor not recommended a calcium score 2 years down the road as a follow-up? The calcium score does not get repeated every year, but every so often we need to do a follow-up and make sure things are not getting worse. So let's move on and talk kidney wellness. What about our kidneys? Well, the kidney is a very important organ. It's one of our major detoxification, elimination organs that's constantly ignored by modern medicine and by conventional medicine doctors until there's an actual problem. Again, to me, it's a extremely mind-boggling approach when the nephrologist refuses to do anything, whether medical or non-medical, maybe because they don't have the knowledge to address a decline in kidney function until it becomes a problem. Or let's say it requires a drastic treatment like dialysis. You might hear a lot, there's nothing I can do about your kidney function. Come see me when you need dialysis. Or let's get you started on this ACE inhibitor, which is a medication that is supposed to preserve kidney function. But this is bad medicine. We need to do something about it. We need to help fight to maintain and possibly reverse kidney dysfunction because we want to maintain wellness. We do not want to wait until we have to deal with illness. There's lots of data and information about how glutathione and NAD infusions could be helpful in restoring kidney function. So let's talk thyroid wellness. Another great example is this very common hypothyroid condition called Hashimoto's. When you have Hashimoto's thyroiditis, you might be told that there's nothing the doctors can do about it. Just watch it. So if there's nothing we can do about it, why monitor your antibody titers? What is the point if we have nothing to address this test and change it, right? So many doctors, including endocrinology specialists, might tell their hypothyroid patients, keep taking the Synthroid or the levothyroxine, come back, let's check your TSH 6 months, maybe a year. That is not wellness. And that is far from actually providing good care. But that is how many physicians manage thyroid. If you want to know more about functional medicine testing for thyroid and the best treatment options for thyroid, please visit my podcasts on this topic. I'm not going to dwell on it here. But how many doctors do you go that are addressing your thyroid that consider testing your iodine? Consider doing a thyroid ultrasound. Consider having a discussion with you about autoimmunity, about a leaky gut, about gluten-free diet. What about a discussion about toxic metal exposure? Is there possible that there's something in your diet that makes these antibodies swarm and attack your thyroid? There are so many avenues and approaches that go way beyond just simply checking your TSH and refilling your medication, that you need to make a decision to choose the right wellness doctor that will hopefully help maintain your thyroid function, the little one that you have, rather than losing it all because it's being destroyed by antibodies. And last but not least, let's use one more example, the hormone wellness example. And let me come back to that optimal wellness I mentioned earlier, give you a few more details and explain what I meant. Hormone wellness is complicated, is delicate and personal to each individual, and it's not necessarily something dictated by a range of numeric values spewed by a machine at the lab. I have many patients and clients who are fascinated with, did you have my results? What are my levels? And that's the first question they ask. And before I even look at the levels and how they changed from the previous levels after we started the therapy, I take my time and I sit down with them and I ask them a bunch of questions. So how is this symptom? And how is this symptom? How did this change for you? How are you feeling? And then after I get a picture of how clinically they feel, I look at their labs. Now, let's talk about this range provided by the lab. The value of low or high that is provided by the lab is what many doctors consider the law of the land. And many patients feel the same way. Well, if you are within range, it means you're behaving and your body's not in trouble. Unfortunately, it is significantly more complex than that. And wellness, anti-aging, optimal medicine practice looks at the range as a guidance. But if you are to have optimal wellness hormonally, well, then your number should be at the top, 80 to 90 percentile. Just like you go to school, you take a test, you get top score for that test. There is no reason to be proud or excited or reassured if your test results come under 50 percentile for one of your major hormones. For example, you should not be proud that your testosterone is under average. If you are a man, for example, and you're told that your testosterone is 580 and you're a 60-plus-year-old man, you should not feel reassured that you are in range, especially because testosterone levels fluctuate, and sometimes they could be even less than 580. You could be at 380. You should be satisfied with nothing less than close to 80 to 90 percentile. The truth is your optimal testosterone level should be close to 1,000, and there are many men with testosterone levels well over 900 in their 70s. So you want a doctor who knows this, who can explain this to you. You want a doctor that knows how to guide you as you invest in your health. Because like I said before, your health is your wealth. And this brings me to another issue. Your specific goals should determine what type of doctor you look for. I mentioned this before, and I will close on this note. If you have zero interest in wellness and you value wellness and health only when you lose it, by now you probably have a diagnosis, a symptom, or an actual medical issue that supposedly a doctor can fix with a medication. You will wait for that to happen, and then you fall in line and you faithfully take your medication without any desire to know more, to learn more, or try to resolve this issue holistically without a medication. Then honestly, any conventional medicine doctor would be a good fit for you. And you should choose one that gives you the time, the patience, and the understanding you will need, but a conventional medicine doctor should be enough. Now, on the other hand, if you are interested in investing in your health and wellness, rather than waiting for disease, rather than waiting for a problem, then you need to seek out a doctor who has an interest in training in this specific type of medicine. And please be aware that investing in your wellness does not mean going to the doctor once a year for a pap smear and a breast exam and faithfully scheduling your mammogram after the age of 40. There is so much more to look into, to address and plan and monitor, and to give you advice as you approach your 50s and beyond. Preparing for menopause and life after menopause as a woman, and preparing for aging as a man, should be something you should consider as you approach and pass your 50s. You need a doctor that can help you prepare. Anti-aging medicine is exploding and growing exponentially. There is so much new information, and there's so fast developing and growing techniques and technologies that a regular conventional medicine doctor that has zero training in wellness medicine, anti-aging medicine, that doesn't have knowledge of optimal hormone balance, bioidentical hormone replacement, multiple replacement options to achieve optimal balance, a doctor who has no training in peptide therapy, in IV vitamins and NAD therapy, in using supplements and vitamins and micronutrient support or detoxification protocols, will unfortunately not be able to provide you with anything on top of a statin, a blood pressure medication, advise you to take vitamins, maybe a bit of advice to eat well and exercise regularly, and that's about it. If you want more than what I just mentioned, if you want a little bit of wellness, anti-aging medicine, bioidentical hormones, peptides, NAD, IV vitamins, then you should look for more. Do your research, listen and ask questions of your doctor, and interview your doctor carefully, just like you interview a potential employee, because this doctor and this medical practice could be your partner in health and longevity for a very long time. I'll end here, and hopefully I didn't bore you too much, and you learned valuable information that you can put into practice, and it will help you make a better decision on how to choose the best doctor for you. I'll say goodbye until I see you again. If you liked the information you heard and you'd like to hear more, please subscribe and follow my podcast. Should you find the content helpful to not just you, but possibly others, please share it and feel free to leave us a review. You are welcome to join the Facebook group, The Warrior Optimizing Wellness MD. I certainly hope that you've heard many things in this podcast that made you go, wow, I did not know that, or wow, I'd like to know more. So keep listening and I'll keep talking.